I don't know about you, but I'm always feeling good when it comes to conversation relating to women. So every Wednesday, we air out our women conversation on the Focal Women Talk. And of course, I am your presenter and your host, Craig Finan Courage Pa. I love to be called Courage. I'm encouraging you to please join this platform on Focal Online TV, where we discuss issues concerning women. We talk about health issues, we talk about career issues, we talk about those challenging things we face in our daily lives as women. Please do not be deterred because you are not a woman at a particular age. Be reminded you can be a girl, you can be a teenager, you can be a woman, and you can still join this conversation. Please join me every Wednesday at 1 p.m. to 2 p.m. where I drill you through with an interesting conversation relating to us women. So please stay with me on Focal Online TV, where we bring you innovation to broadcasting. Thanks for watching. I am your host, Craig Finan Pa, saying have a blessed day.
So, good afternoon, folks. Good afternoon, Liberia. Good afternoon, far away from Liberia. My name is Queen Courage Bar, and when I'm talking about issues relating to females, I love to be called Courage. So let's do away with the title or however you call it, just for encourage as we are talking about these interesting conversations centering around females. So today I'm going to be talking about contraception methods. The last time we talked about contraception, and we got to know what is contraception, what are contraceptives, and every other thing that was needed to be brought forth to you for you to learn about. So just to do a recap, contraception is the act of preventing a pregnancy. So sometimes the medication, the procedure, some of the things we do, that is what we call contraceptives. So just so you know, this month of January we're gonna be talking about contraception, and next week Wednesday we're gonna have a representative from Lydia Pills and from Lydia, and she's gonna be talking about the whole thing concerning the Lydia Pills and everything, because it's one of the methods too as well. So for today, I'm just gonna be doing a straight run. If you are watching me live now, I encourage you to make use of my comment section. Please make use of the comment section. Let's talk about these things very quickly and sharp. So contraception method or methods of contraception sometimes is listed below are effective. For example, you have the IUD, you have the pills, you have the injections, you have the condoms, and a lot more. So this tell you that all methods of contraception are effective. However, there is no method that is completely 100% reliable. The reliability of each method is given in percentage, or they are given in percentages. So one thing I want you to know is this: all methods of contraceptive are not 100% reliable. Let's go to the CD that most of the times female use. We have others that use condoms, right? Most times the issue of condoms are not 100% reliable, because there are sometimes you see people using condoms and all of a sudden you hear them saying the condom burst or XYZ. So it's just the scenario to tell you that it's not always the measure of contraceptive, right? The method is not always 100% reliable. It is not 100% reliable, but that doesn't mean it doesn't work all of the time. It works, but it's not 100% reliable. So the reliability for each method is given in percentages. So it's given in percentages like 80%, 75%, 89%, 98%, but it's not 100% reliable. So if the method fails in less than 1 in 100 women, the number of women who fall pregnant may be given per 1,000. So that is just a clear calculation of that. Quickly, we have contraceptive injection. This is what we're going to be talking about throughout today. So the contraceptive injection contains a progesterone hormone. So it is used to prevent pregnancy. The reason why it contains progesterone hormone is because it helps to prevent pregnancy. And the progesterone hormone helps to prevent pregnancy. So someone want to know, why is contraceptive injection? So contraceptive injection is an effective form of contraception that is given to prevent pregnancy. Remember, the whole issue surrounding contraception is to prevent pregnancy. So if you have the injection, it is to prevent pregnancy. If you have the pills, it is to prevent pregnancy. The condoms, it is to prevent pregnancy. The IUD is to prevent pregnancy. So just so you know, I would love to talk about that. I'm actually looking at the time as well. So the contraceptive injection is an effective form of injection that is given to prevent pregnancy. It is also a progesterone hormone called Depot, and it has a long biological name that is depot drug progesterone acetate, and it's called DMPA. So the progesterone hormone are very similar to a woman's own hormone called progesterone. So you know, we have our own hormones in us. We have our hormones that react differently. You see some women, their hormones, sometimes they have pimples, they have acne. These are all hormonal outcomes. So just to move quickly, how does contraceptive injection work? Someone would like to know, how does contraceptive injection work? So the injection work by injecting progesterone into a muscle or it works in three ways. The contraceptive injection that you should know, contraception injection, it works in three ways. It works in three ways. One,
about you, but I'm always feeling good when it comes to conversation relating to women. So every Wednesday, we air out our women conversation on the Focal Women Talk. And of course, I am your presenter and your host, Craig Finan Courage Pa. I love to be called Courage. I'm encouraging
We apologize in our studio. We apologize from our studio here. We had some kind of technical issues, but we are back again, hoping that we could proceed with our show. Viewers have just dropped, but we know they will come back on. But in line with our topic for this one, we are talking about contraception, and we are talking about contraceptive today, and we are talking about the issues of injection. So that of course you should know. We are talking about contraceptive injection, and of course I told you anything that has to do with contraception, it has to do with prevention of pregnancy. So the issue of the injection is effective, and it's an effective form of contraception that is given to prevent pregnancy. That of course you should know. So we were listing the three ways. So the injection works by injecting progesterone into the muscle or under the skin. It works in three ways. How does it work? Stopping the release of the egg from the ovary. That is one way it works. When they inject you, it stop the release of eggs from the ovary or through ovulation. Taking in the mucus at the neck of the womb. This is another thing it do. Taking in, that is, it make the mucus stick at the neck of the womb or cervix, which forms mucus plug. So they stop sperm getting through the womb or getting through the womb through the uterus to be fertilized or to fertilize an egg. So thinning the lining of the womb, it also thin the lining of the womb. This makes it unlikely that an egg that has managed to be fertilized will be able to implant the womb. So this is how the issue of the injection work. These are things that occur when you are being injected or when you want to get on a contraceptive injection. It stops the release of egg. It taking in the mucus around your womb. It stop it. That is the reason why no egg is fertilized, and it thin the line of the womb as well. So there are advantages and there are disadvantages. I would love to talk about the disadvantages of contraception today. So disadvantages of contraceptive injection. The injection cannot be removed once given. That is one thing we ought to know. Once the injection is given, it cannot be removed. Any side effect may last for more than 2 to 3 months until the injection wears out. So sometimes the injection they are giving you, those health practitioners will tell you the duration of the time you're supposed to go back for them to do, let me just say, a renewal for them to give you another more again. And sometimes you see people are on 3 months. They call it family planning. I'm on 3 months family planning. The injection they give them. So the injection cannot be removed once it is given to you. The first time you go, if they do your checkup and everything, like I said during the previous show, it's always good for them to do checkup for you. So the first time the injection is given, it cannot just be removed right away. Like, oh, the injection I think away, so I no, it does not work that way. Any side effect may last up to 2 to 3 months until the injection can waste out. So it may take some time after the last injection for you to become fertile again. So it may take longer time. It may take some time for you to become fertile again. When they say fertile, they are talking about you being prepared to like get pregnant. So sometimes you see female talking, I was on family planning, but now I'm from family planning since I got married. Now I can get child and blah 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 because it have not weighed out yet. So it takes a longer time to weigh out so that you can be fertile again, so that you can be vulnerable, so that you can be ready, you can be prepared, your body, organs, everything can be prepared for you to have child or children. So this time varies from woman to woman. It is not specific, but it varies from woman. My case might be different from your case. That's the reason why I say it varies from woman to woman. It can take up to a year before fertility returns. Please get this right. If you are on the injection pills that last maybe 2 to 3 months, and you for all of a sudden you want to leave it, you want to have children now, or you want to have your child of your own, It does not happen right away. Sometimes it take a year because you're only for a very long period. So sometimes it take a year with consultation from your health facilitator. So if it takes consultation from your medical doctor, you goes to see him, he tells you what you're supposed to do and all of the things you're supposed to follow. And the procedure takes a year plus for you to be able to become fertile again. This delay is not related to the length of time you use this method of contraception. Yes, it says that it does not relate to the longevity in which you use the method for. So there is a possible link between the injection use and cervical cancer. They say there is a possible link. So I mean, we talk about the advantages. We will talk about the advantages, and we are on the disadvantages. So there are a lot of disadvantages, and we are here as well to learn about that. So there is a possible link between the injection use and cervical cancer. It is not known if this is because of the injection or other factors. It is important to be up to the date with cervical smear tests. It does not protect against sexually transmitted disease. So yes, if you are on if you are on the injection and you think that it can protect you from STI, it can protect you from gonorrhea, syphilis, no, it does not prevent you from sexually transmitted diseases. So your periods are likely to change during the first few months. Some women have irregular bleeding. Of course, these things happen. You have irregular bleeding, which can be heavier and longer than normal. However, if these things are happening to you, it is unusual for heavy period to persist. After the first few months, it is more common for the period to become lighter than usual. So after the first few months, your period will not be intensive and way it can be heavy. No, no, no. It will not happen again. So many women have no periods at all. Many women have no periods when they are on the injection, that is the contraception injection. Many women don't have period at all, which many see it as a benefit. The longer it is used, the more likely it is that period will stop. So the longer time you are on injection, after every 3 months, you go back after every 3 months, is the longer time your period will stop. So after 1 year of using the injection, period stop for about 7 in 10 women. Some women find that having unpredictable or irregular period can be a nuisance. If you develop irregular bleeding while receiving the injection, then you should inform your doctor or nurse. This is clear. If you receive or if you develop irregular bleeding while receiving the injection, then you should inform your doctor or nurse. Please report anything that is abnormal with you. Report it. You may also be able to have your next injection early or be given other treatment to stop bleeding. So once you report to your doctor, you may be given other treatment to stop the bleeding as well. Irregular bleeding can sometimes be due to another reason, such as an infection. This needs to be treated. So some irregular bleeding at times can be the cause of infection. So this may also be treated by your doctor. Contraceptive injection side effects. So apart from changes to period, menstrual cycle, side effects, all of these things are uncommon. Hear me straight. Apart from changes to period, that is menstrual cycle, side effects are uncommon. Side effects are not common. Don't say they a common mean it can happen to me. No, no, no. Side effects are uncommon. So get that straight. So if one or more should occur, they often settle down over a couple of months or so. One possible side effect is weight gain. One possible side effect of the injection. One possible side effect of the injection is weight gain. Most often you see people who are on the injection, sometimes their weight increases. Sometimes they are not, if they used to be slim before, no, they are not. So this is one common side effect of the contraceptive injection. We have people who are feeling Abu Bijalo is back online. Thanks to you, Abu Bijalo, for joining us. If you are here watching, we encourage you to kind of make use of our comment section. So this is for that. And like I said, One common possible side effect is weight gain. Weight gain, you're getting big, you're getting fat. This seems to be a particular problem for young women under 18 years. Most often you see it. You see your friend check your fat. I wasn't happy you fat that day. But in that you're enjoying or no. This is one common side effect of the contraceptive injection. The injection they can give you for 2 months. This is one of the side effects. Who are already overweight when they start the injection. So some women also report fluid retention worsening. You get acne, you get headaches, and breast discomfort. Yeah, some women complain about that. These are all side effects too of the injection. They report fluids. You get worsening acne. Your acne just become aggressive. Your headache. You have breast discomfort. You have a lot more. So, however, there is a little evidence that the injection causes these symptoms. Of course, there are little evidence that injection causes these symptoms. Already, females, we have headache, we have hormonal imbalance. Sometimes acne becomes aggressive, even if you are not on contraceptive pills or you're not on the injection. These things happen. So sometimes there are little evidence that the injection causes these particular symptoms. So the most common reason for women to stop having the injection is because of irregular bleeding. This is the most common reason for women to stop having the injection. So if you are on the injection and you are having irregular bleeding, you should be able to stop it. This is the common reason why you should stop it, because of irregular bleeding. I don't know who is watching this, but this is educative enough for you. Some of you who are on family planning. So the injection can lead to some thinning of the bones. This does not usually cause any problem and the bones go back to normal when the injection has stopped. It does not cause a lot of problem. Using injectable contraception for many years might lead to more bone thinning. It is therefore recommended that you have a review every 2 years with your doctor or nurse. They will discuss if this method is still the best choice for you. Like I said before to you, when you want to get on any contraceptive method, it's good you visit a health practitioner, precisely a doctor. They will tell you what is this and what is that. Who cannot have contraceptive injection? Everybody cannot be on contraceptive injection. Not because your friend is on it, so it means you can get on it. No. That's not how it works. So the issue, most women can have the contraceptive injection. Your doctor or family planning nurse will discuss any current and past illnesses with you. For example, you should not have it if you have had breast cancer. If you have had breast cancer before, you cannot get on contraceptive injection, not even the pills you can get on. And if you had liver disease or cardiovascular disease, that is the heart, you cannot get on contraceptive injection, such as angina or a stroke. You cannot get on contraceptive injection. If you have risk factor for thinning of bones, you cannot get on. It's not advisable to use any method of contraception. Please get it straight. If you have any risk factor of thinning of bones, then it is not normally advisable for you to get on contraception. So before you get on contraception, I encourage you to always visit a health practitioner, visit those who are in a field of contraceptives, let them be able to educate you, do all of your tests, and be, like my friend can say, be eligible, be suitable for that particular issues, for that particular thing before you get on it. So it's good enough that you take note of all of these things. So we just like run up today to talk about the methods of contraceptive, and our focus was on contraceptive injection. We talk about contraceptive injection. Contraceptive injection is used for prevention of pregnancy, and anybody can just get on contraceptive injection. You have you have to be you have to follow the reference procedure by your doctors. You have to be examined before you get on contraceptive injection. So there are 3 ways the contraceptive injection works. It stops the release of egg through your ovary or ovulation, taking of the mucus, it taking your mucus around your womb to protect it for your egg to not be fertilized. And then it has this teen lining of the womb. That is why it does. So we talk about the disadvantages. Disadvantages of contraceptive injection. We talk about the side effects may last up to 2 to 3 months until the injection wears away, and it may take some time after the last injection for you to become fertile again, sometimes a year. So it also has some common issue as it relates to cervical cancer. There is a possible link between the injection used and cervical cancer. There is a possible link. So thanks for joining us today. Of course, I love you, and I'll be back on next Wednesday with a representative from Lady of Contraceptive Pills, and they will be here with me in studio for this talk show. So thanks for joining us. Don't forget, my name is Karish, and I'll be back next time. I love you, and happy pre-ladies night to all of you that will be going out to chill. Don't forget to be careful, protect your peace, protect yourself, protect the energy, protect the company you get around, so that you can be able to smile all of the time, so that you can be able to live a free and fair life. Thanks for joining. Now I'll be right back tomorrow with the daily edition of Inside of Media. I love you. Bye bye.